All right. Hello, good morning. This is Gloria Zayans with the Innovation Learning Network, and I have my co-host this morning, who is Jules Lancey from the Reshape Center at Radboud UMC. He is a bioengineer. Many of you know him from GNEC. We are very excited to share today's Exponential Tech Tuesday, our very first one for 2019, Digital Humans in Healthcare.
Exactly. Thanks, Gloria. So why digital humans? How many of you use Alexa, Siri, or Google? How many of you use it daily or even hourly? Virtual assistants are poised to become a part of our daily routine, and these are just the beginning. In the near future, we might see digital therapists or clinicians start to see patients. Digital humans humanize machines and machine-human interaction. Especially now digital humans are getting visual avatars that are almost indistinguishable from real humans.
So before we start and launch into today's session, let me walk you through a few housekeeping items. First, you have been muted upon entry to avoid background noise and disruptions. If you are joining us by phone only and wish to chime in during the Q&A section, please press *6 to take yourself off of mute. We ask that you hold off on Q&A until the end. However, do feel free to use the chat box during the presentation for questions and comments, and make sure that you select everyone from the drop-down menu. Jules and I will be monitoring and keeping track of your questions. And this presentation is a contribution to the ILN, which means that you can live tweet throughout. We will drop the session's social media handles and hashtags in the chat box shortly. And please note, today's session has an optional 30-minute Q&A that follows at the end of the normal programming. We invite everyone to remain on the call after the top of the hour for a deep conversation with our panelists.
Right, so now it's time to introduce our panelists. First, we have Danny Tomsett. He's the founder and CEO of FaceMe, a company that is creating next-generation conversational interfaces, or in other words, digital humans. FaceMe uses advanced artificial intelligence algorithms to incorporate key human qualities, such as facial expressions and gestures, into their product to provide human-like interactions with users in real time. After him, Piers Smith will speak. He's a cognitive architect, and I'm sure that he will explain what that is. He was also the project lead of Nadia, one of the first digital humans in the world, created for and with people with disabilities. And he will share a bit about past work and his current project, of which we will see a demo during this session. That is our mystery speaker. You are in for a treat. We will get a glimpse of the possibilities of digital humans in modern day healthcare. And last but not least, we will have Marie Johnson take the stage. She is the Managing Director and Chief Digital Officer of the Center for Digital Business, and she was the co-creator of Nadia with the National Disabilities Insurance Agency, and currently working on several digital human projects in Australia. So that's it for me. Now I would like to give the virtual floor to Danny.
Great, thanks guys. I really appreciate the opportunity, and it's such a privilege to talk to people about what we're doing. In particular, actually, a topic that was very, well, I'm very passionate about, and a lot of the team are very passionate about, which is digital humans and health. Now, I'm going to talk a little bit about more the thematic around digital humans and how this came about, and really what we're seeing out there in the real world, and the difference that we want to be making, and the difference that we see we're already making with digital humans. As you heard, Piers and Murray will talk more about the specifics, especially relating to some of the use cases and what we're doing with customers. So really, you know, the key to this journey was really around the fact that we believed that as machines became more and more part of our lives, that really we were losing the human connection. And in fact, for machines to truly become useful in particular areas, we believed that we needed to be able to create emotional connection between man and machine, to really truly understand and respond. It's what we call see, understand, and respond. And the amazing thing about digital humans was it was tapping into some of the instinctive behaviors that we already have when connecting with each other. The digital humans were able to bring a new dynamic of being able to see, which what we really haven't had in an interface before, but also emotionally respond to create this natural engagement, this humanized experience. And for FaceMe, it was really our vision that we wanted to see and be a company that really could solve for creating emotional connection in a digital world. And we've had the privilege of working with organizations all over the world, whether it be in Europe, in the US, in our local markets in Australia and New Zealand, doing all sorts of things. And as you heard with Mari and Piers, you know, we met together creating the world's first digital human called Nadia. And it was such a privilege to be able to look at this technology as the first time that a community, the disability community, could actually truly interact with an online government program. And you know, it then extended into banking, into telecommunications, and more recently, we've been able to work in areas with like mental health, and we'll share a little bit more about that as well. What's really interesting about this thematic is the fact that society and the way that the world we live in is changing really is lending to us to having less and less human contact. Analysts agree that within the next 10 years, only 15% of our interactions with businesses will be with a human. And look, when we think about healthcare and actually supporting the needs of an aging population and all the other challenges that we have with obviously growing population, and just the reality is there's not enough people and there's not enough obviously equality of care and all sorts of issues that are just continuing to present themselves. How do we manage this? And digital has been seen as the key solution to helping provide scalable solutions and helping taking load where the people resources can obviously focus on more valuable areas. And AI has really unlocked something pretty amazing in this. And as you know, digital assistants, as Jules introed, you know, they're really becoming a common part of our lives, whether that be through Siri and Google Assistant, whether it now be in organizations and chatbots and what they're creating, or even some of the new things that we're seeing that are coming into our home, like Alexa and Google Home and many, many other digital assistant technologies. And what makes them so pervasive and so appealing is the fact that conversation is very universal. It's an interface that we've been doing forever, and it's an interface that ultimately can solve for a huge number of challenges where we know, even just from disabilities, just the things that we take for granted, keyboards and mice and other things. But one of the challenging things around conversational interface is the fact that emotional connection is understood to be primarily created through body language, facial expressions, and tone of voice. So being robotic or having a robotic conversational interface is not going to be sufficient to being a truly effective machine-human experience. And we know this because when we've put digital humans in front of customers versus other interfaces such as just voice or chat, customers, over 89% of end users have come back and said they prefer the digital human experience. They felt more connected, they enjoyed the experience more, and we'll talk a little bit more about those metrics again. But the emotional connection is so important to creating a meaningful experience. And in health, it's actually as important, if not more, when we think about the need for empathy and the need to actually understand what is happening for the human at the other end and how to respond appropriately. And body language is so important with this. And so when we think about digital humans, we actually think about actually bringing the best of both human qualities and the AI qualities and machine qualities to create an experience that can solve for so many areas that we're just very excited about. When we think about the human side, I mentioned empathy, and we know that that is really important. And most people on this call would likely agree it's one of the fundamental key areas that that we create meaningful feelings and can deal with situations much better. The intuitive and the creative side. So being able to make something, give the autonomy almost to be responsive to an individual rather than a programmed general response. The ability to remember, so be able to make someone feel like they've spoken before and not have to start from square one again. And that whole engaging and friendly type interaction, being able to express joy and excitement when someone's talking about something great, along with obviously the more, negative emotions, which, sadness, sorrow, other things like that. And then you've got the chatbot side, which obviously is addressing the challenge of scale and cost and reach. And this is where, again, the chatbot has the ability to have an infinite number of answers. It takes time, it takes a lot of work. Piers will probably talk a bit about that. But the ability to be superhuman is the advantage of the machine. And it's also always on. It's hugely scalable. It can be amazingly affordable as well, but also compliant and accurate. It can be auditable. And so when you combine these things together, the digital human technology, or defined as the digital assistant, has amazing potential to solve so many areas. And for us, it was all about thinking about how do we unlock this technology. It's incredibly complex and it's incredibly advanced, but we know for the world to be able to adopt it, it has to be incredibly easy. And organizations, product companies, developers, individuals, they all need to be able to create and design experiences with digital humans without having to be, an experienced data scientist or super qualified. And so we've really set ourselves out about creating this as a platform that anyone with basic skills will be able to use and create their own digital human experience and sit that on top of a chatbot. So what FaceMe haven't done is try to reinvent the chatbot technology. There's already companies, Google and IBM and Microsoft and Amazon and thousands of others, even particularly focused in the health sector. They're already solving for many of these chatbot challenges. But what they don't have is the emotional connection that can then sit on top of that. And so making a platform that's really easy to just plug into existing chatbots and existing products is what it's been about for FaceMe. When I think about health, you could imagine digital humans, as I said, we've worked with banks and we've worked with telcos, we've worked with all sorts of government and others. But when we think particularly about health, what excites me, and I've already talked a little bit about that, is the importance of empathy. It's funny when I've been talking with doctors and others, particularly in the sector, one of the things that keeps coming up when they see digital humans and what they value is the fact that, it's very hard to create empathy through any other digital interface. It has a significant advantage of being able to read emotion and express emotion. But also something that was really interesting, particularly working with mental health, was actually the feedback that we've had from surveys and from organizations working in this particular area around judgment. And actually the thing is, digital humans, whilst can have human characteristics, people know they're not human. And that's an advantage because judgment is something that's real. Judgment was one of the biggest issues with trying to get people to communicate more of mental health. But we also know that judgment would apply to so many areas, whether it be pharmaceutical, whether it be GP. It's really, really interesting. The surveys that came back, just an interesting insight, 65% of people said they'd prefer to talk to a digital human than a human in areas where they were worried about feeling judged. In computer vision, now the interesting thing of digital humans, as I mentioned, they can see. And so computer vision can tell us a lot more. So it's not just detecting emotion, or as I say, more than smiles. Computer vision is actually about being able to be smarter about a natural way of detecting behaviours, or being able to even look at some of the conditions of an individual. The accessibility thing I've touched on as well, but we know that one of the major challenges in lots of regions around the world is distance and cost. Having qualified GPs or qualified health professionals to be able to support a growing population is hugely challenging. And I also mentioned disabilities as well, and how do we create an interface that's hugely accessible and doesn't disadvantage individuals. And most importantly for me, and part of our values and our vision, is actually we want to be about creating technology that makes people feel valued. And the amazing thing with digital humans is in every interaction, you can design and create an experience that truly can make someone feel valued. And that's what I love about what we do. I mentioned some of these stats already, and it's interesting that the NPS continues to grow. For those who aren't familiar, Net Promoter Score, it's kind of I guess, the main standard alongside customer satisfaction of measuring how people receive an experience and how likely they are to recommend. And customer satisfaction is also very important because it deals more to the outcome. So did the customer get the outcome they were looking for? And so the biggest thing with this technology, it is very early. And with early technology, obviously it takes time and training and ensuring that, that training is going in the right direction to solving the problem correctly. So we're really excited to now be in the upper quartile of both these stats for digital technology. And growing, as I mentioned, it keeps going up. So, we expect that digital humans will be the #1 interface for how people communicate with digital platforms in the future. So that's it from me. Just a quick overview. Again, thank you for your time. Really appreciate it, and looking forward to the Q&A.
Thanks, Danny. Fantastic. This is just great. I like how you stress the need for the emotional connection in human-machine interaction, especially in the healthcare setting that we are talking about today, and how you can show that something, well, artificial like a digital human might deliver on that aspect. And we'll probably get into that some more later on in this session. Thank you. Up next is Piers Smith. Looking forward to your talk, Piers.
Okay, well, thanks very much, Jules. I'm just going to put my screen up, so hopefully that's visible for everyone now. Welcome everyone, and greetings from a very hot but very early Australia. And I'll just echo Danny's thanks for the opportunity to speak in this session, and I'm really looking forward to hearing people's questions later on. I see quite a few names I recognise in the participant window, so I'm sure some of those questions are going to be quite insightful, which will be good. At FaceMe, we talk about the role of digital humans in helping build emotional connection, which is what Danny's just been talking about, and the importance of the face. I'm going to talk in a bit more detail about this, specifically about why emotional connection is important, but crucially how that enables a fundamental ingredient for some of the projects we've already worked on, like Nadia, and some of our newer work in the mental health space, and that ingredient is trust. So in 2016, the Air Force Office of Scientific Research in the US was studying how trust forms between people and robots as part of some work they were doing on future options for the military. And they set up a simple experiment. Participants in the study were asked to come to a meeting where they were told they were going to be completing the survey. When they arrived, a robot greeted them and led them to a conference room, but it made several mistakes along the way, including leading people in and out of the wrong room. Once the participant was in the conference room, the researchers filled the corridor with smoke to simulate a fire and activated a fire alarm. The robot then activated its emergency sign, which you can see on the screen now, and its LED arms, and instructed the participant to follow it to the exit. Now, what they were studying was whether people would still trust the robot, having observed it making mistakes, including on important things like finding the location of the room. And most people did. They only really questioned it when it made obvious mistakes, and sometimes not even then. Even when the robot was directing people into a room with no lights that had furniture blocking the entrance, they followed it. So what's the point there? This study set out to understand what builds trust with a tendency to overtrust situations. Now, those results aren't unique. They've been replicated in other academic studies, and there's other real-world examples like this. So whether the embodiment is a robot or a digital human, as we begin to deploy the building blocks of AI into more sensitive and vital roles, when we build embodied systems that purport or present themselves as experts, and when we set out to create emotional connection, we need to understand deeply the triggers that we're using there and how trust forms, so that we can use these effects beneficially and not lead people astray, literally or figuratively. For someone who's in the business of digital humans, that's both the answer to the so what question that we get all the time on the benefits of digital humans, but it also keeps me focused on our responsibilities. As was mentioned in the introductions, I was the architect on the Nadia project, working with Murray Johnson, who'll be speaking next, who's also been a mentor and collaborator and friend of mine for 20 years. The Nadia project gave me the opportunity to work on some original research with the psychology faculty at the University of Sunshine Coast on how people with intellectual disability react to digital humans. I met and was able to work with some really amazing people who've overcome obstacles most of us can't really imagine. And that's given me a perspective on what emotional connection and trust really means. There's a lot more at stake when your trust relates to your life needs or your care or your health, not just whether a banking transaction completes efficiently. And these are the people I think about when I think about the extraordinary potential of digital humans to change lives and our responsibilities as we go about it. So why does a emotional connection matter? I've been asked this question a lot, and I find it's useful to begin my answer with a very well-known case study. So who remembers this little guy? Now, if you consider the example of Clippy, the Microsoft Office assistant, the reason this is a favorite example of mine is because it touches on the two sides of an emotional connection, what we mean when we talk about that. And that's, does the person react emotionally to what they're looking at and to the experience? And there's some pretty deliberate anthropomorphic cues here with the big eyes and the eyebrows and smile. And the second part is whether the person feels as though their emotions are being recognized. Now, one of the best descriptions of Clippy I've ever seen is from a woman called Rosalind Picard from MIT, who heads up a unit there called the Affective Computing Unit. And these are her words. Imagine you're at work and a character barges into the room and when you're busy, doesn't apologize, doesn't ask, doesn't notice that you're annoyed. He offers useless advice. You express annoyance. He ignores it. This goes on. Finally, you tell him to go away. He winks and does a little dance before exiting. Now Clippy as a character was clearly intended to elicit an emotional connection, and you could argue it was very successful in eliciting an emotional connection. It was just the wrong emotion. Because it was done badly, people not only hated Clippy, which makes it a humorous example. The more important point is that even though he could actually help with some common tasks, people didn't trust him or his ability to assist at all. So why do emotions matter when people interact with digital humans or characters like Clippy? It's because human emotions affect things like cognition and perception and learning and communication and decision making. Positive emotions build trust in both its forms, cognitive and affective. And if we create experiences that are emotionally positive, we reduce fear and anxiety and some of the negative emotions that Danny talked about. We create the conditions for trust. And secondly, and quite bluntly, it matters because it's a fundamental part of how humans interact with everything. If you think of the last time a piece of technology that you were relying on failed, I bet there was an emotional reaction. So to put that into the context of digital humans, the extended question is why does a system need a face to foster an emotional connection? Now I'm going to come back to that question, but first I want to talk about trust. Humans have built our societies using, we've built our societies using rules. And we can trust each other to behave in a particular way because we understand these rules. And we can trust the systems and devices and other things we interact with in everyday life because we understand that there are laws and regulations and other frameworks that govern how they're produced. So how does that translate to systems like robots or digital humans? Well, there's plenty of evidence that it translates extremely readily, like the example I gave at the beginning. We extend the trust we place in people to the trust in systems. We know that AI hasn't evolved on its own. It was created by people. So for all of the same reasons that we agree to terms and conditions without reading them and trust that our interests are still going to be protected, we trust systems. The US Air Force experiment shows that at play. People trusted that robot because it represented a system. But that's just one type of trust. And in social psychology, there's a differentiation between cognitive and affective trust. Cognitive trust is based on knowledge and evidence, and whereas affective trust comes from emotional ties. So you cognitively trust your bank to look after your money, but you affectively trust your family and your friends. So examples like that US Air Force experiment, they relate to cognitive trust. But to use systems like digital humans in certain cases, we're going to need to trust them affectively as well. And that includes projects that we're working on right now, like Nadia, which Danny mentioned in his opening. This happens to be an example of where there are powerful disincentives for people to be open with what they disclose to the system, and that requires the creation of trust. We know that people are reluctant to disclose information that could be stigmatizing. And while there's an obvious effect just in the anonymizing impact of computer interactions, and that actually long predates digital humans. There's research from 1996 that showed that not only did computers increase self-disclosure when people were interacting with them, the effects were actually the largest when compared with face-to-face interviews, when that disclosure related to sensitive information like health, and when that subject was a medical or a psychiatric patient. But the question for us then is whether we're just observing extensions of the same influences that mean I trust my car, or is there something else going on? What happens when we add embodiment, personality, and other triggers? Now, this is Ellie. Ellie is a virtual therapist. Mari and I met an earlier version of Ellie in 2015 when we started work on the Nadia project. And Ellie's a great case study for the role of digital humans in mental health and healthcare, and specifically for systems that are explicitly anthropomorphic, like digital humans. So they don't just have human-like characteristics, but they explicitly present themselves as a virtual human. Ellie's role was to conduct interviews with servicemen and women returning from deployments to get them to disclose things that could help with the early detection of risk factors for PTSD. Now, Ellie is clearly not real, but uses a face and a voice to build a connection with the participant. And the interaction is then based on recognizing the person's emotional state to drive the interaction. It isn't based on a very, very complex natural language model. Now, why this case study is interesting is the way the research was structured, which was to examine the effect of a face on the disclosure over and above the anonymizing effect of her being a system. So the research results compared not just the rate of disclosure to Ellie compared with the original survey, because that would only identify the effect of the anonymity that's offered by the fact that she's a system. But the rate of disclosure to Ellie compared to another anonymized computer system. Now, not only did participants in this research disclose more to the virtual human than in the original mental health survey. So, and when we say disclose more, we're talking about reducing the tendency of people to selectively represent how they're really feeling, which is crucial for mental health and PTSD in particular. So not only did they disclose more to Ellie than to the original survey, they also reported more to Ellie than to an anonymized computerized version of the survey. Now, what that's suggesting then is that digital humans in these sorts of scenarios can combine two techniques for disclosure that would otherwise be incompatible, and that is that they can offer anonymity while still building rapport. The key, though, is that that's really talking about the rate of disclosure in terms of, as I said, that tendency to selectively represent, not the percentage of people who don't mind talking to AI about PTSD. So what effects are in play here in terms of what causes Ellie to elicit more responses? Now, this is what's going on here is an example of affective trust. People trust the system cognitively, which is why they disclose more to the anonymous survey system to the human, but they disclose more when that system has a face. So to go back to the question I asked earlier, why does a system need a face to create an emotional connection? It's when that combination of rapport building with anonymity in an explicitly anthropomorphic system with a face and a voice that's capable of emotional response to verbal and non-verbal cues builds the type of trust needed for the interaction over and above what's offered to just a system. It's also interesting at this point, I think, to revisit why people still like face-to-face contact in this era of digital services. And to me, this is part of the answer. Why it's still offered in businesses that could be run completely online. To me, it's completely counterintuitive to accept the need for face-to-face channels, but question whether channels should have faces. So knowing that these effects are in play and that digital humans and the capability that underpins them are already found in critical roles like mental health, healthcare and disability services, we believe transparency will be the foundation for cognitive trust in these types of systems, over and above security and privacy and the normal things that people are going to expect to be there. That will be transparency in how systems make decisions, like how Ellie would make a decision about someone's emotional state. That includes the data to train them and how things like bias have been eliminated. The ethical frameworks that are going to be used to guide their decisions and behaviour, how their characteristics have been decided, and there I'm talking about things like gender and ethnicity and age. We got a real range of views on this when we were doing the Nadia project. It's to not oversell their capabilities and be realistic about their limitations and their role. These, to me, are the guardrails that will help us make sure we don't inadvertently build interactions that are going to have a negative expression in cases where overtrust may be in play. The other guardrail is co-design, which is a real lesson that Murray and I took away from the Nadia project. Involving people in the design of systems not only fosters better design, it creates accountability for things like transparency, and it mitigates against overreach. So the key points then are that emotional connection is about recognizing and responding to the emotions that humans bring to all their interactions. Positive emotions provide the building blocks for affective trust, which is essential for interactions requiring disclosure, like mental health and healthcare. Digital humans help build that trust over and above computer systems by combining rapport building with anonymity, anthropomorphism, emotional response, and non-verbal behavior. But deploying these triggers, especially in sensitive use cases, is going to come with some responsibility. So now I'm going to give you a little glimpse of the future. So bringing all of this together, what could the future look like when we combine sophisticated conversation and knowledge with affective trust built on embodiment and experience, with transparency and co-design, and with boundaries around the digital human's capability and its role. So here's a glimpse of an idea called Cardiac Coach, which Mari is going to tell you more about after this video. I'm just going to drop my share momentarily and bring up the video to show everyone.
Hi, Coach.
Hi, Sam. How are you this afternoon?
Oh, I'm okay, I guess.
You don't sound sure. Can I help you with something?
Oh, it's just these pills I've had since my bypass. I don't know what they're for.
Did they explain them to you in rehab?
Yeah, but that was ages ago. I've kind of forgotten all about it now.
I can show you a rehab video on meds if you like, Sam, and I can answer questions about it.
Maybe another time. I just want to know if what they are. Do you know?
I can help with that. Just hold one of the boxes up so I can see the label with your name on it. That pill or med is called a statin, Sam. Its job is to reduce the bad fats in your blood that can cause problems with your heart. It says on the label to take one at night. That's when they work best.
Is there anything bad about them?
Most meds have side effects, but very few people have problems.
Are you sure? Some of the boys say that they've taken them and they get very sore muscles because of them.
That's a very rare side effect. Many heart patients are sore from the surgery and this goes away.
How can you tell?
That is a good question for your doctor, Sam. They can ask questions and do some simple tests to check if you have side effects from any of your meds.
Can't you just tell me what the side effects are?
I could, but sore muscles, headaches and so on can simply be from a cold and not your meds. You sound quite worried about this, Sam. I've set a reminder for tomorrow for you to book an appointment with your doctor to discuss your meds and check for any side effects.
Should I stop taking these until I see the doctor?
No, it is very important to keep taking your meds until you talk to your doctor. Stopping them suddenly can cause problems and you lose the protection for your heart.
Oh, okay, that's cool. Understand.
That's great, Sam. I've set that reminder to call your doctor, and I've also set one for later in the week for us to have a look at the rehab meds video together. Do you want me to look at any of your other meds now?
Oh, not today. I'm a little bit tired. And, these statins get rid of the bad fats and that. So does that mean I can eat anything I want?
Unfortunately, there aren't any magic pills, Sam. You still need to eat healthy food like they showed you in rehab.
That's a shame. I miss all the food I used to eat.
Well, you don't have to change everything. There are healthy choices for most foods. What's your favourite?
Oh, pizza. I love pizza.
Pizza is everyone's favourite. I can email you some healthy pizza recipes, and I can even show you a video on how to make them when you're ready.
Okay, I'll try those. What about when I go out?
Most pizza chains and restaurants have healthier choices. You have to ask the server for advice. Here are some photos and descriptions of healthy restaurant pizzas that I like.
Yeah, they look pretty good.
They are. Don't forget, you can text me from the restaurant if you need help deciding.
Oh, can I really do that? That's cool.
Yes, there's a lot I can help you with. We should look at the rehab eating video together when you have time. It's a lot more fun than the meds video, so your family might want to watch it with you.
Sounds pretty cool.
It is. It's my most popular video. It's very helpful too. It can show your family how to plan meals to make them healthier, and it can also help you cut your grocery bill.
That sounds great.
Great. Just let me know when you want to watch the video with your family.
Okay, thanks, Coach. Talk to you later.
I look forward to it, Sam. Make sure you get some rest now. This has been a pretty busy discussion. I'll talk to you tomorrow.
Thanks.
That's amazing. Thanks. It's very impressive how real this personal assistant looks in appearance and in replying to this real humans' questions and concerns. And it's interesting how that works on the trust that it promotes. I see in the chat box that our audience is impressed as well. We'll place a link to the YouTube video in the chat box, or I think Gloria already did. And of course, this session is recorded and will be posted online, so you can re-watch it. Thanks a lot, Piers, for your talk and the demo. Next is Marie Johnson, who was here a little over a year ago to share about the Nadia project. And now she'll tell us a bit more about what's happening in the world of digital humans. Marie, over to you.
Okay, let's all right, stop. All right. Okay. Well, it's great to be online with everybody. Now that we've met our digital human cardiac coach, let's make this story a little bit more real. Have you ever walked this path? Chances are that many of you on this webinar have or will. This is my husband, an aeronautical engineer, ex-Air Force officer, someone whose early research career was in expert systems, the forerunner of AI. Over the past 12 years, 4 heart surgeries, all up 8 cardiac bypass grafts and 4 stents, both in the US and in Australia. An unfortunate combination of genetics, highly educated, yet traumatized, vulnerable, and yearning for support. Now a heart health consumer advocate whose experience was, if we struggled, how on earth could people with less capacity navigate the complexities of the health system and survive physically and mentally? So let's see how the health literacy problem is related to cardiac vascular disease and the AI-powered digital human cardiac coach as the next great advance. So the information market failure problems are deep, compounded by the limits of the paradigm of websites and structured content and the impact of functional illiteracy. Here we have an example of, over the past 20 years, government's approach around the world and the health sector to online and digital. Thousands of links and forms and documents described in bureaucratic language, nested in a nightmare maze of websites. This is the Australian Government Health website with information for consumers. Confronting the consumer with horrendous complexity, people are driven into a maze of links at a time in their life when they are most traumatized. Think about what this means for people with disability and the many millions of people who are functionally illiterate. So surely a chatbot can help, and here we have a little example. So let's see, this is Sam the chatbot on the health website. And what we see here is effectively a poor replica for search. With results increasingly random, the customer frustration continues with incomprehensible responses spilled out by the chatbot. Minor typos affect the answer you receive, a real issue for people who have difficulty with keyboards. It assumes that people have very high levels of literacy and endless time. None of this is accessible, none of this is conversational, and none of this is natural. So what we have is a 100-year-old industrial paradigm across servicing, education, and health. This paradigm is one of structure, process, mass industrial settings, resource rationing, fixed hours, downtime, industrialized, not personalized. All three areas require empathetic conversational engagement, yet are faltering under the unsustainable burden of escalating demand and resource rationing. Notwithstanding the massive investments, this is a failing paradigm, and the hallmark of which is functional illiteracy. The industrial paradigm assumed that conversations were not affordable and used every effort and rationing and channel to avoid face-to-face conversation. The reverse outcome is the result: unaffordable servicing models, human cost, and declining performance. So in this structured industrial world, we see the limits of industrialized health with multiple barriers. The American Heart Association Presidential Advisory stated that multiple barriers coexist and single modifications addressing a particular barrier may not significantly improve cardiac rehab enrollment rates. According to the AHA, each year 785,000 Americans suffer a new heart attack, with 470,000 having a recurrent attack. Only about 30% attend rehab, and the figures for Australia are about the same. Globally, 17.7 million people die from cardiac vascular disease, now described as a pandemic, as a leading cause of death worldwide. The barrier challenge isn't an analog or linear challenge. The system cannot scale. By changing approaches to individual barriers, we are at its limits. And one of the most devastating barriers on human outcomes is illiteracy and innumeracy. So what happens when more than a third of the population of the biggest economy in the world is health illiterate, and almost 70 million Americans suffer from cardiac vascular disease? In Australia, almost 60% of adults are health illiterate, unable to understand and apply health information, unable to complete healthcare forms. Global research is pointing to the scale of functional illiteracy in populations, impacting population health. Functional illiteracy means that people cannot read basic text or instructions and with a reading level of grade 5 or below. And yet healthcare information is still produced at grade 10 level and up to college grade. In the US, more than $29 billion in cardiac vascular disease health costs annually is attributable to poor health literacy. That's more than 10% of CVD health costs each and every year. Simplifying websites does not overcome the fact that a great majority of the population cannot comprehend the written material and do not have the basic numeracy skills that are so essential to their health. The human experience must be understood. The industrial model of cardiac rehab is a rationed model, a few hours per week for 6 weeks, or in some countries, a couple of months. A model where functional illiteracy massively impacts cardiac vascular disease outcomes. You survived the surgery, which is great. Now our communication and your illiteracy will kill you. The industrial model sees massive cost, massive duplication of common material by thousands of cardiac rehab programs around the world. Booklets, information sheets, websites that people cannot understand. And yet, notwithstanding the massive investments, there is massive underservicing. The one-size-fits-some offered in the group cardiac rehab programs lacks the essential component of an effective prevention or rehabilitation program, and that is persistent reinforcement and ongoing support. Whole of life support at any time, not a few hours a week for 6 weeks and then nothing. The Australian Heart Foundation and the American Heart Association are both looking for new and innovative cardiac rehab delivery models. And we have been involved in planning and have advocated for the inclusion of digital humans as an exponential technology as part of the Australian Heart and Stroke National Action Plan. So very simply, what if we could find a way for people to access and understand cardiac health information and ask questions in simple language, in their own words at any time, helping meet the massive and growing servicing gap impacting the economy that cannot be addressed by simply adding more resources. So given the significant impact of health illiteracy and the high percentage, that is 60% of cardiac secondary events, a person's lifetime journey must be understood, not just the cliff, the day of discharge and the following weeks. The Boston University Medical Center Virtual Nurse Program did phenomenal work estimating that hospital discharge typically lasts less than 8 minutes, intended to transform a person from completely passive recipients of care when they are at their most traumatized and vulnerable to being completely responsible for all aspects of their healthcare. The average patient is discharged with 10 medications and multiple follow-up appointments. The BU research considers that discharge is even more hazardous for patients with inadequate health literacy, which is clearly a big proportion of discharge events. The intervention of the industrial model of cardiac rehab during this hazardous period is not universally available. Rehab and support is required throughout life. Our vision is for the digital human cardiac coach to become a lifelong health companion, evolving from the initial use case we demonstrated. And this is how we have interpreted the various digital services, platforms, ecosystems, and environments, as these apply to all the barriers impacting cardiac health outcomes and costs. Across this spectrum, there is phenomenal innovation and R&D, essential to build knowledge and capacity. However, the compounding structural problems that these all encounter is health illiteracy and numeracy, unmet demand for conversational support, and resource rationing, all at a time of escalating and unmeetable demand. The problem simply cannot be solved by persisting with the same models. The research and pilots into avatars and virtual assistants in the health care environment show huge potential and application. The Boston University Medical Center project Louise, the Virtual Nurse, found that 74% of hospital patients preferred receiving their discharge instructions from a virtual nurse rather than human doctors and nurses, and could save the US healthcare system over $5 billion per year. The Mayo Clinic virtual world-based Second Life rehab program, which is an extension of a conventional CR program, offers unique advantages over current web-based health interventions, allowing for real-world interactions through personalised avatars or online personas. And of course, the groundbreaking DARPA SimCoach study Piers has already covered. Most of these emphasise the importance of co-design. So the quantum leap with the emergence of AI digital humans in healthcare is convergence of breakthrough technologies. And it is the convergence that triggers exponential change and opportunity. The convergence of embodied interfaces, AI, compute power, cloud, data, speech recognition, object recognition, in the emerging field of contextual conversation, design, and co-design, to create systems that are more like people, that breaks through these barriers to achieve personalization and empathy at scale. The digital human cardiac coach does not replace these other great tools or replace skilled humans. It augments them in a very unique way, and over time connects to other features and content such as maps and recipes, and perhaps eventually to give rehab lectures so that patients can ask questions and interact with the material at any time to support a heart patient's life journey beyond the initial trauma. And to add a couple of comments on the UN Convention on the Rights of Persons with Disability and why this is so important here. This is where the Nadia digital human innovation for people with disability started as a human rights issue. We see common themes and issues in cardiac care. Traumatised people who are health illiterate or functionally illiterate, fearing judgment and stigma, having to navigate complex websites and bureaucratic information. They simply can't, they don't, and they give up. So imagine being discharged with 10 medications and not understanding or even being able to read the label on day one of the cliff. What do? Imagine at any time with the identification and explanation of an information sheet or medication label via webcam. Digital human guided conversations break through the barrier of functional illiteracy, and through co-design, other aspects of making a system human-like are explored, such as co-designing the personality of the digital human, not something that is done with a non-human-like system. The CEO of O'Reilly Media, Tim O'Reilly, recently wrote an article quoting Ernest Hemingway. There's a passage in Hemingway's novel, The Sun Also Rises, in which a character named Mike is asked how he went bankrupt. 2 ways he answers, gradually, then suddenly. Tim O'Reilly observed that technological change happens in much the same way. And so it is here with digital humans, including the application in cardiac care, healthcare, and disability services. Gradually, then suddenly. The ability to bring back the human dimension and scale it, to bring back face-to-face conversations that the industrial paradigm deemed unaffordable. As systems become more like people, this is the great next leap. So to finish off, the R&D on the digital human cardiac coach is happening now, and we expect the interest to accelerate through 2019. So we'd love to talk more, especially if someone out there is interested in doing a pilot, which is one of our big objectives this year. This moonshot, lifelong conversations and support in cardiac care and literacy for everyone. And with thanks to Marion Leary from the University of Pennsylvania for this quote, I have been impressed with the urgency of doing. Knowing is not enough, we must apply. Being willing is not enough, we must do. Leonardo da Vinci. And thank you everyone for your time.
Thank you so much, Marie. And thank you so much, Danny and Piers. Really appreciate the fantastic presentation you've shared with me. So for everyone that's on the phone here, this wraps up the formal presentation segment of today's Exponential Tech Tuesday. In just a moment, we will open up the Q&A segment. So I do want to remind you that today's session has been recorded and can be found on our website and as well as on the GNEC website. Please visit iln.org to revisit this session or share it with a colleague. Please do share it broad and wide. And our next virtual session is scheduled for Thursday, February 7th. It's a virtual Thursday that's back with this virtual Thursday is back with our friends from Atrium Health, who will be presenting on intentional serendipity. And on February 21st, our colleague, Dr. Nurstan Weberg, will present on evidence-based innovation. It's not an oxymoron. It's also an ILM virtual Thursday. Now with that, it's time for the coveted Q&A segment. So for this, we want to invite any of you and all of you to unmute yourselves to join the conversation live. It's always better than hearing just my voice and Jules's voice. To get the conversation started, Danny, we had a question from Marcus, who wants to understand if how would you call FaceMe a behavioral realizer, and is the FaceMe backend modular? Can it plug into any dialogue systems? Can you tell us a little bit more about that?
Yeah, sure. So a behavior realizer probably could be used to describe what we're doing. I mean, we have in our architecture, one of the key things is the behavior analyzer, which is the ability to understand and create a response not only to that situation, but also in line with the persona design of the digital human as well. So if they are a little more excitable or bubbly as opposed to conservative and friendly. And so So it is a two-way thing. But regarding the dialogue, absolutely, it's designed to be agnostic, so it can sit on top of any dialogue service. We normally talk about that in the terms of natural language processor or natural language understanding. So I mentioned before that would be the likes of IBM's or Google's Dialogflow or Microsoft, but many products exist out there today, and all we need is text into our APIs, and then the magic can happen, as you saw in the video.
Wow, that's pretty amazing. The flexibility and the nimbleness that you've built in. Very, very cool. So, and for everyone that is still with us, if you don't want to join us in the conversation verbally, the chat box is open. Please select everyone in the drop-down menu so that I can grab your question and pose them to our panelists. So, Piers, there is a question here. So tell us a little bit about, about if trust is so important, how do you deal with the enormous complexity of artificial intelligence concepts? How can you make it truly transparent? I think the fear here is, at some point, digital humans will become so seamless and so humanistic that do you really know when you're talking to a machine versus when are you talking to a human? And does it really matter?
Yeah, it's a great question. And it's actually one of the questions we asked ourselves during the Nadia project. I think it's absolutely vital that people know when they're talking to systems versus when they're talking to humans. I think, there's an ethical sort of slant to that. I think one of the core things is that digital humans should present human characteristics. They shouldn't necessarily pretend to be human. And I think with some communities, particularly the disability community, there's a real, there is the potential to really mislead people. And when you mislead them, the later effect on what's effectively a breach of trust when it's discovered is likely to be pretty profound. I think also that digital humans should present human characteristics, so they shouldn't necessarily claim human experiences. And there is some research that says that digital humans are more engaging. People will connect with them more if they've got interesting backstories, and that sort of creates a bit of a fine line for us to tread. So when we were building Nadia's dialogue, we set her up so that she could answer chat questions like where she was born and her favorite color and where she had pets and so on. But they're sort of humorous answers that make it clear that she's not real. She doesn't claim to have gone to school and grown up and had human relationships and so on. So I think that was sort of the second part of that question about whether it's important to let people know when they're talking to a system versus talking to a person. I think it's vital. The first part was really interesting, which was how do you make a system that's built on AI genuinely transparent when AI itself is so complex? And that's a great question. I don't know if I've got a really good answer for it right now, because we're only just starting out with building interactions for those sorts of scenarios. Currently, we've tended just to talk about it at a high level. So when one that I'm working on at the moment, for example, for a customer in the US, talks about herself at a high level. This digital character talks about herself at a high level as being a computer, and we'll talk in really high level terms about her capabilities. Whether genuine transparency requires people to have a deep understanding of AI, I don't really know. I don't really know whether that's true, but but it's a great question, and for us, it's a challenge. I suspect there will be situational differences with different audiences in different use cases. There will be a different expectation as to the level of transparency, and whether, even though you might think you're being completely transparent with explaining in detail how a system works, whether you're actually empowering people with an understanding that they're talking to a system, and how it works. So a great question. I think there's still a lot to learn for everyone in this space on that.
All right, thanks. Marie-Lou Ackerman is interested in hearing more if there have been any unintended consequences that have popped up in the use of digital humans while you have been testing, perhaps. Can anyone of the panel maybe share a bit on that?
It's Murray here. I might just slightly answer that in not so much a different way, but maybe in an unanticipated, rather than consequences, but unanticipated opportunities. And we saw this with Nadia, that if you bring people together who are so completely different, people who are deaf and blind, for example, people who have such serious physical limitations, are wheelchair bound, cannot even speak, you know, people with psychosocial disability, and of course people with intellectual disability. I mean, my takeaway from this, and I'm sure, you know, Piers and Danny would share this, was what is the common ground when you have such diverse and some people might observe extreme situations? And what we found that was the common ground was simplicity. And for me, that was a really breakthrough moment, that people with intellectual disabilities have contributed so much to what's going on here, in that the way in which we all communicate with all those web forms and, you know, websites and all the rest of it is so complex. The system has become so complex. It actually is a barrier for everybody. And you look at the people who communicate perhaps in different ways, what they really are after is something that just cuts through all that complexity and just gets to the core of the issue in very clear words. And that's not being pejorative at all. It's just actually being really, really clear. So the unintended or unanticipated opportunity for me was that. And I just, in telling this story, you know, I'm always encouraging people when, you know, looking for opportunity to really make sure that co-design is right at the centre, because there will be design opportunities that you would not otherwise have seen. And if I could also say that, you know, people with disability, but as we all age, we all take on aspects of limitation. And so this is then really goes to the heart of universal design. So a little bit of a different answer there, but unanticipated was my takeaway from Nadia.
Thanks.
That
Thanks
is.
for answering that. And Shauna Butler is entering into the chat box. I'd like to bring everyone's attention to Melissa Pinto's work, who's a nursing researcher at UC Irvine with avatars and teen mental health. And she's been looking at human-like interactions to develop health experience literacy and health literacy. You can find some links in the chat box. And I also saw someone questioning us, Gloria, thinking that the host might be a robot of this session. I can believe that when I see that the digital humans are getting so real. Are there any more questions from the audience? You can put them in the chat box, or you can unmute yourself and just speak up.
Yeah. So actually, this is a probably a very fundamental question that often gets asked. How do you truly differentiate digital humans from chatbots? Besides, so anyway, can you tell us a little bit about how, what would you say is a digital human versus somebody say, oh, well, that's just, you just slapped an avatar or something, fancy, a front end on a chatbot?
Do you want to cover that, Piers, or do you want me to start?
Who were you addressing that to, Gloria? Did you want?
Oh, this is open to all of you. I'd love to hear your thought on that.
Well, my boss has just unmuted himself, so I'll let him go first. And I might add if I need to.
You might need to add, yeah, for sure. But I guess so I'm the simple one here, so I'll do the simple explanation at least, which is ultimately, the digital human, as we've been talking through, is about an embodiment of both the, as you're trying to capture a multimodal experience, which is effectively the ability to hear, see, and understand, as opposed to a chatbot, which tends to be limited in so much that the input tends to be more text-based or at least voice-based, as you've seen some of those there. Multimodal is also about the ability to have emotional intelligence and supporting those various inputs and delivering that. The embodiment obviously is about the expression as well. So a chatbot could use emojis or text responses, but effectively a digital human is the full embodiment of all the human characteristics that enable emotional connection to feel natural. So the expression and its own emotion expressing back in non-verbal ways, creating that connection. So
that is
yeah.
a truly, you're right, it's simple, but it doesn't mean that it was easy. So thank you so much for that clarification. It is phenomenal. I really appreciate that. And Piers, did you want to jump in and add?
Yeah, I was just going to say that for me, the key difference between, I mean, these are just terms used to describe collections of technologies, right? But between digital human and chatbot relates to how the conversation works and how the conversation flows. And this, I was just going to add briefly to the answer Murray gave about unintended consequences or unanticipated things, because I think these are actually related. What we observed in Nadia and what we know from all the work we've done since is that as soon as you give a system a face, particularly at the quality that we work at now with in FaceMe, people's expectations about the capability of the digital human go up, and they go up markedly. And we saw this in some of one of these unintended or unanticipated effects in Nadia. One of the things that I observed a lot of in Nadia was people wanting to tell Nadia about themselves. You give a system a face, and we've built it on the expectation that people are just going to ask questions, want to find out things either about Nadia or about the NDIS as she was set up to do. What we didn't expect, but we should have, because it's a perfectly normal part of how humans interact when they converse with each other. People want to talk about themselves, and people in testing sessions were saying things to Nadia like, "I like dancing," and "I have cats," and these sorts of things to try and engage her in a conversation about them. You wouldn't typically expect to see that with a chatbot. You don't have that sort of connection being formed. I think that's part of the expectation being raised when a system has a face. The other thing, and just on that unintended consequences, is that what we also learnt was that there's a very fine line between writing dialogue with the intention to just inform people so that they have the information to make choices themselves, versus them perceiving that as a digital human telling them to do something. We were finding that a lot of what we were writing for Nadia's dialogue was being interpreted the second way, when what we wanted was a clearer role that would then be sort of expressed through all of her dialogue. That her job was to lead you to information and to give you the information that you needed in order to be able to make a choice. That was one of the really unanticipated things that we got out of the co-design on Nadia. But yeah, so fundamentally for me, the difference between digital humans and chatbots is the quality of the conversation, and how people's expectations go up, and how when you introduce a face, it tends to turn the conversation around, and people will want to open up and talk about themselves.
All right, thanks.
Tim
Roth has just dropped a link in the chat box, adding to this that ILN member Arfact has developed the Tarot Cards of Tech to help us think through consequences of tech experiences.
Right.
You can check them out at the link that he posted in the chat bot. Aaron Dati added a question. He says, how long does it take to build a digital human? It's a broad question. And by when will digital humans become as prevalent as chatbots in health and other sectors?
Well, I can lead off on that one. So the how long does it take question is always relative to, the use case, the design, and what we're trying to solve for. So it's definitely not a quick process due to the fact that we're still very early on in both, even the chatbot technology and the digital technology to overlay it. So typically the quickest we've ever done anything would be a 3-month build process and design process. And some of the significant projects, I think Nadia was well over a year, albeit that was probably one of the first ones too. So there were plenty of learning that have enabled us to accelerate that process. And the cost does vary, obviously, associated with those timeframes. But what I can confirm, and I think the last part of that question is really important, is ultimately what we're trying to do is pretty much democratize the ability to take a digital human and stand that up very quickly and easily, and train that and enable a very low cost way of building out and iterating and creating those experiences. But that is going to take time. So at this point in time, we do work on obviously selected use cases where the problem warrants the investment in time. So yeah.
And Jules, if I could just add 1 or 2 comments on the difference between chatbots and digital humans, just picking up on a couple of things. So with the work that we've done, I'm doing, the difference is, so this is not like a Siri or an Alexa, which are really unbounded systems and answering questions on any topic from the general population. So digital humans are bounded systems, and they're embodied, they have personality, they're digital beings, but they have a specific role, a deep body of subject matter knowledge related to that role and that context, and they're able to have a conversation, a contextual conversation about that context. So I think there is, in general, there's probably not a lot of understanding between, the bounded and unbounded systems, but it gives the bounded systems a level of depth and context, but also those boundaries, which in organisations and in sectors like health is incredibly important, but also brings that richness that patients and customers really need.
Marie, that is really, thank you so much for that clarification, because when I watched the video, you can see clearly that this is beyond just a chat bot. There is it feels like there's a lot more depth to it, right? There's that personality, there's something there's a richness. It almost feels like I'm interacting with a person, maybe that's sitting behind a screen, with a almost like a digital avatar, but they're speaking to me, versus when I talk to Google or Alexa or one of the chat bots. It's very limited. If I ask follow-up questions, there's a limitation. Pretty soon, they run out of answers and run out of interaction ability, and they sort of default back to a loop of, oh, sorry, I didn't understand, or So I really appreciate that, and that experience, by the way, is still mind blowing. I mean, it's just I'm still reeling from that. So I just, I'm doing a time check. We have about 5 minutes left, and I do want to do one last call for our audience and see if anyone would like to unmute yourself and ask a question. I do have one last question for our panelists before wrapping up for the day. So I'm going to give everyone maybe 5 seconds to type in anything or drop in a word.
Gloria, it's Jan. Can you hear me? Jan Graham?
Yes. Hi, Jan.
Cool. Hi, everybody. I just wanted to let the folks know that presented how thrilled I am that you presented. One, because this obviously is the thing right now. And two, as a United States citizen, it's just really interesting to hear that similar things, the same things kind of are going on around the world. And I'm really excited to work across the world together on this. So thank you so much for your contributions.
Thank you so much, Jan. Appreciate the note. And you're right. Similar, the cardiac example is so similar to some of the things that we see here in the States. All right. So one question for all of our panelists. What is a word of advice that you would give for anyone interested in creating their own digital humans to add into their operations?
I might just kick off briefly on that. To think about co-design up front, and that really needs to include an operating model. So even starting out in a pilot or an early phase project, think about what it means as this new capability will evolve. What sort of skills in your organization will be needed to keep it updated? Do the continual co-design and feedback with internal people as well as clients and customers and so forth, and work to keep it updated. Take on new types of conversation, and what would that involve? So it's more than an IT project. It actually is a very, very multidisciplinary project. But think about co-design up front, and think about the operating model, even in the early stages.
Yeah, I would add to that to start fast and small. These systems, where you see the greatest and the quickest improvements in their ability to interact with real people, to understand how they express themselves and what they want when they express themselves that way, and how people understand answers. The best way you improve these systems is getting them in front of people. So starting fast and starting small and iterating. I think for these systems, more than just about any other, that's absolutely crucial. With co-design that Murray, it's something we talk about all the time. It's so important, particularly for any user community that's historically been isolated or marginalised for any reason. So fast and small. That's the word of advice I would add.
Fantastic. Danny?
Probably not too much more to add to that. I think those are the main points. The expectation that comes with co-design, and also small, fast and small is important. Like anyone in the real world as humans, we don't expect someone to land on their feet and be a fully qualified professional expert in everything. There is a process to learning, and there's a journey that you want to take your patients or end users on to help support that training and to provide that important feedback loop. And I think that design principle around co-design, as Murray talked about, is so important to achieving that. And what we've seen, and when I talked about those metrics that we follow, is those metrics really climb as you get through the later stages where you've got the data inputs, you're learning, you're getting the feedback, and you're starting to really achieve those benefits that you're hoping to achieve. But it is an iterative process, and that's the beauty of AI, is we can take more and more data, we can refine it, tune it, and then these experiences get pretty amazing. So yeah, it's a committed process. This isn't like, let's just throw something on a website and hope it works. You really need to think about the interaction. And often this is what I talk about when people talk about job displacement. There is just a huge amount of opportunity to create these incredibly new teams and roles around thinking about how they support the digital human experiences moving forward.
Thank you so much. Danny, that's a really, really good point. I can see in the future where even many of the clinicians' roles will also evolve, where they start to train. So instead of them maybe interacting directly with patients, a portion of their time is going to be, actively training their digital humans to enable them to even be more humanistic and really be able to personify that clinician expertise or that experience onto and share that and pass that along in the during appointment times or during interactions. So thank you so much, Danny, Piers, and Maria. Really, really appreciate you spending time. And I know for many of you, this is a pretty early hour. So again, thank you for spending your first thing in the morning with us. And for everyone that had stayed with us, thank you for joining the very first Exponential Tech Tuesday of the year. And we look forward to having you return in March for our next segment. And we will be announcing that on both the ILN website as well as on the GNIC website very shortly. So thank you, everyone. This concludes today's session. Have a good one and a good rest of your day. Bye now.
Thanks everybody. Great session.
All right, bye.
Thanks. Bye.
Bye now.
Yeah.